We present the case of a 6-year-old girl, victim of a high-energy car accident, sustaining multiple blunt trauma injuries, including to the spinal cord with consequent paraplegia, and abdominal trauma that resulted in a transverse colon perforation with onset 5 days after the trauma, and about 1 month later a duodenal stricture submitted to a duodenojejunostomy. Another significant injury was to the urinary system, with a right ureteral laceration, with an associated urinoma, which is the focus of this presentation. Here is the CT scan from the day of the trauma, showing the urine extravasation, and thus the diagnosis. In the day of hospital admission, an ureteral stent was inserted. The patient had a prolonged hospitalization of nearly 2 months, with no major urinary complications. Follow-up was maintained in the outpatient department, and revision of the ureteral lesion was scheduled for 3 months after the initial stent insertion. An ureterography was done. A transition zone was revealed in the proximal third of the right ureter, where no contrast passed, diagnosing ureteral stenosis. Due to an intense physical rehabilitation program, surgery was only scheduled after its completion, approximately 5 months after the ureteral stenosis diagnosis. We planned for a cystoscopy with ureteral stenosis dilation using a high-pressure endovascular balloon. After identifying again the ureteral stenosis, we passed the balloon through the ureter and fitted it to the region of the stenosis, as you can see from the 2 small black marks. The balloon has a 40 mm length. The balloon was filled with diluted contrast until the maximum of 5.17 mm diameter with 12 atmospheric pressure. Under direct visualization, we saw the ureter being dilated. After a 7-minute wait, we deflated the balloon and inserted a new ureteric stent. The surgery went without any complications, and the patient was discharged the following day. The child remains clinically stable, and a revision is planned for the next 2 to 3 months. Post-traumatic ureteral stenosis can present a significant challenge in pediatric trauma patients. Minimally invasive techniques, such as this one, can provide effective management of this condition while minimizing the need for more invasive surgical procedures. Continued monitoring and further revisions are essential to ensure long-term patency and kidney function. Thank you.